Hello everyone. In this narrated presentation, we're going to look at the core values that guide community health workers. In this specific instance, we're learning about these values so then we can build upon the more specific guiding principles of ethics and law in further narrated presentations. Let's get started. We have outlined some key community health worker values for this presentation that include access, acceptance, advocacy, excellence, learning, partnership, self-determination, social justice, strength, trust, and unity. But what are some other examples? Also included could be equity, equality, healing, positivity, reciprocity, community investment, civil service, civic duty, helping aptitude, vocational calling, and humility. There are many different values that make up community health workers, but we'll go into further detail on these on the slide. Access. The ethical principle here is that community health workers strive to ensure equal access to services. All persons have the right to access healthcare, human services, and support services needed to improve their health. And nothing you plan to do for a client or patient means anything if they can't get to you or you to them. But even if you can get to them, part of your job is to help figure out ways for people with limited mobility or time to have the best shot they can at accessing quality healthcare. So can you think of a time where you or a friend or someone you know had a hard time making, keeping, or getting to an appointment? What did they end up doing? What could have helped them have an easier time? So let's look at some examples of ways you can help your clients overcome some of these access barriers. Some things you can do is during a home visit, you could perhaps tape a bus schedule or flyer to the fridge. You could suggest that the client carpool with someone they know on the way to work. You could arrange for a family member to babysit a child while the person is away for that specific appointment. And you could also consider, especially nowadays, a telehealth alternative. For acceptance, the ethical principle is that community health workers strive to remain open-minded and are accepting of others and our differences. We are inclusive and accepting on all levels. This is always a work in progress. You are not perfect. Nobody is. You may run up against someone who really rubs you the wrong way. Take a minute to remind yourself of your role, try to leave judgment aside, and have an open attitude. For advocacy, the ethical principle is that community health workers advocate for communities, individuals, and the field of community health work. We develop the capacity of individuals and communities to advocate for themselves. And that last point about developing capacity is key. You should take action to support your clients' rights and should speak up when you think they are being treated unfairly. But you should also empower them through providing them with contact information, for justice organizations, and help them with phrasing their concerns or other resources, all to help advocate for themselves. It's like the old saying teaches. You give a poor woman a fish and you feed her for a day. You teach her to fish and you give her an occupation that will feed her for a lifetime. For excellence, the ethical principle is that community health workers strive for excellence by providing quality services and the most accurate information available to individuals and communities. Healthcare is profoundly important to people. It's their bodies, their minds, their spirits. As a community health worker, you can provide crucial assistance and support to people. You have to do your very best to provide the best care you possibly can in every instance. How would you like it if you knew your nurse took a shortcut in listening to your breathing, opting just to listen to your lung sounds from the front and not also from your back and sides? Provide the best service and information to your clients that you can. The stakes of health are high, so any wrong information could be harmful. If you don't know something, be honest about it and tell the client you're working with that you'll have to find out and let them know later. The ethical principle for learning is that community health workers embrace learning as lifelong, including life experiences as well as traditional learning. We seek ongoing opportunities for education and training to expand our knowledge base and skills. So community health workers are always learning. Your education is never over because healthcare is constantly changing and improving. This shouldn't be seen as a negative. Rather, you are an integral part of a dynamic process of getting people healthier, and you need to do your part to keep up with the changes. It won't feel like more work to do. It will actually make your job more interesting. For partnership, the ethical principle is that community health workers are partners in the design, implementation, and evaluation of community health worker programs. Communities, families, and individuals are partners in determining their needs. So we pursue equitable partnerships with other professionals, including healthcare and social service providers. More and more, healthcare providers and health insurance providers are recognizing the important role community health workers play in providing quality care. Part of your role then, in turn, is recognizing those partners and other health professionals as your partners. Advocate for yourself to be involved in planning community health work in the communities you serve. Make yourself available as a community expert. Don't be afraid to initiate a partnership where one doesn't seem to already exist. The other partner may not have thought that you would be interested, or may not have recognized the benefit of having a health worker living within the community served as an equal partner. The ethical principle in self-determination is that community health workers shall determine the direction of the field. We will make the decisions concerning training and education, best practices, and policy development. We will define the field of community health workers. You know why? Because no one knows best the way to do this work better than community health workers themselves. You can lay out a list of values, ethical concerns, skills, and tasks, but then you get to the real-life experiences, and it could all seem to fly out the window. What happens on the ground in communities and in people's homes can only be learned through experience. That experience is crucial to add into planning and eventually developing policies that promote the job. There should be opportunities for you to give feedback on your experiences, what works and what doesn't, wherever you end up working. If that opportunity doesn't exist in your organization, suggest a mechanism to make it happen. The ethical principle of social justice means community health workers are agents of change. We pursue social change through work with community members to improve social conditions. You don't work in a vacuum. Community health workers are not only enmeshed in the communities they work in through social, school, religious ties, and others. You may be involved in or at least exposed to issues of social justice or environmental justice all the time. Is there a concern about the quality of drinking water in your town? Are morning walk-in hours at the local clinic flexible enough so people working a night shift can still get access to care when they are off work? You may find clients telling you about their challenges, but are already convinced they aren't fixable. As a community health worker, you need to think outside the box and take action to seek out information and solutions to these problems. Remember that when you take community action, it's best practice to involve community members themselves who are affected, so they can feel empowered and effective in creating the change they want to see. The ethical principle in strength is that community health workers assist families to acknowledge strengths and build upon them. All communities and families have strength. I'm sure that if you look around at your colleagues, you can come up with things about them that you admire. You may have heard their stories and examples of how they demonstrated great strength or courage at some point in their lives. Your clients are the same way. Each client with whom you've come into contact has strengths. It's part of your job as a community health worker to figure out what they are by asking questions and getting to know them. A patient may not necessarily know what his or her strengths are, so it'll be a great opportunity for you to reflect back to them what you see as strengths in their personality or their experience using that strengths-based perspective. It's not just for a feel-good moment. Recognizing and drawing attention to a patient's strengths will make you more effective at your job. Use all of the resources at a client's disposal, including themselves. And maybe most importantly, through recognizing their strengths and how you apply them, you will help transform their attitude about their own healthcare, making them better self-advocates moving forward. Trust is always number one, and the ethical principle here is that community health workers have earned the trust of individuals and communities. We respect that trust and work hard to maintain a trusting relationship with individuals and communities. As you see in this definition, trust is not something that happens all of a sudden in just one interaction. You are going to need to build rapport with your clients, listen to them really well, and build a relationship. You need to respect their wishes, provide information respectfully, and model integrity. Don't rush trust. Keep it as a goal in everything you do, and once you have it, don't betray it. The establishment of trust is integral to the effectiveness of a community health worker. It makes a big difference as to whether or not your client will feel comfortable enough to follow through on the resources you provide to them. And finally, unity. Community health workers, regardless of discipline, region of the country, or job title, all work within or outside of traditional systems and are unified in our work to reduce disparities. As you move through your professional life, you can enjoy the fact that community health workers have a strong sense of shared mission. Most community health workers are doing the job out of a desire to help people and help their communities, especially those who are vulnerable. Consider joining a community health worker organization to participate in educational and celebrational events so you can come together with peers to learn from and reinforce the joys and challenges of your work.